Hello, this is Harry Hobson, President and CEO of Plymouth Harbor.
And I'm Karen Novak, the Administrator for Strategic Healthcare Initiatives here at Plymouth Harbor.
Good, thanks, Karen, and certainly our point person for infection control here on campus. Karen, let's do our update today, and as folks can see at the bottom of the screen, is Monday, July 13th, 2020. Several things we want to talk about this morning. As usual, the COVID-19 status report. Then we'll go into our plan that we're in right now. We've been working all weekend getting that implemented. And then we're going to talk about our no visitation policy and maybe try to provide some answers to our residents and family members as well. So Karen, why don't we go right to the COVID-19 status report?
Sure. Currently, we have 7 of our staff members that have tested positive for COVID. They are kind of concentrated over in the assisted living memory care area as well as dining services. They all are doing very well, asymptomatic. We have one that has tested negative, and we're awaiting the second negative for that particular person. And then a number of them that we have taken their first test after they're positive, and we're hoping that will come back negative, and we'll get them back on duty as soon as possible. We also, this weekend, had our first positive resident over in the memory care area test positive. This person was exhibiting some signs and symptoms on Saturday morning, was sent out to the hospital, and then tested positive for COVID, and a few other comorbidities were identified as well.
And that's really our first positive confirmation from a resident perspective.
Yes, that is correct, but we're very thankful. Right now she's doing beautifully over at the hospital, and we imagine she will definitely be coming back to the COVID unit in Smith Care Center.
And that's what I want to spend a moment talking about upon discharge from the hospital, because people will ask us that question. So our resident is at Sarasota Memorial, confirmed COVID, with the probability of being discharged within the next day or so. Karen, what's it take from the hospital perspective to declare that discharge? And then what do we do upon admission here? And as you said before, the unit where that person will go, and for how long?
Sure. There's a process that has to take place when a person is discharged, regardless if they're positive or negative for COVID, going into a skilled nursing area. There are certain criteria that the hospital has to submit to Smith Care Center, as well as an order. They will also put up a referral up online, and we have the ability to really look at that referral. And what that is just truly an overall synopsis of the medical record of the person that's in the hospital that lets us know what's going on with that particular patient/resident. And that's really, really important to know for the nursing factor, because we know what to expect, we know what we need immediately on hand to provide the best care for that resident, and then we know too what to look for should something change in the status of that resident when they come here at Plymouth Harbor. The resident that is positive for COVID will actually come to the COVID unit in Smith Care Center because she will need extra care. Now, if a resident maybe from the independent side that is positive and went to the hospital, but they're absolutely fine, they can return to their apartment and stay in that apartment isolated as long as they're able to take care of themselves. It's those that need that extra care, and we do what we call a matrix on them to determine the level of care that they need, and we put them in the appropriate place. This lady will definitely need an extra level of care, so she will go in the COVID unit in the Smith Care. She will go into that unit for a total of 14 days because she was symptomatic. Stay there because we want to make sure that she is totally free, negated from any kind of COVID. We will do 2 tests on her. We'll need 2 24-hour apart negative tests before she's allowed to come out of that unit. During that time period, though, she'll still get her therapy, as well as when she's discharged from that unit. I'm sure that they'll keep her on the Smith Care unit or area just to have therapy come work with her. Sometimes people get a little bit deconditioned when they are immobile or just kind of not moving around quite a bit. And we want to make sure that when our residents leave Smith Care Center, they're ready to be back at that level that they were prior to them going to the hospital.
Right. Okay, absolutely. Karen, also mention the team members, that how we staff that unit, a little bit different than the regular staff.
Yes, we have to look at the population that's actually in the COVID unit. Currently, we have one person in there as a suspected positive. So we have a nurse that is designated specifically for that particular resident. That resident has one-to-one nursing. Now, that nurse in the COVID unit does not go out to Smith Care Center during the time that this COVID unit is active. We keep that one nurse in that COVID unit for that duration of time that that resident is in there. Now, that doesn't mean she's in there 7 days a week, 24 hours a day. She does go home, but her assignment during the time that she's here at Plymouth Harbor is in the COVID unit. The last thing that we want to do is do cross-contamination and have that nurse out of that unit going to a different environment, and that would be Smith Care.
Karen, I don't know about you, but one of the signs of my new normal and many of my colleagues, and I'm sure you as well, is what would we do without Zooming? And, we used to call it teleconferencing back in the day. But quite candidly, we spent significant hours with our team here at Plymouth Harbor this weekend. Saturday, Sunday late as well. And the purpose of that Zooming was really to make sure we had our plan in place. Who's going to do what, when, and how. So we talked about the plan. It is in place right now. I know that we refer to it as our COVID-19 staffing schedule, but we've really beefed that up a lot with this. Isn't that right?
Absolutely. Again, we go back to keeping that environment contained and really addressing that environment as an entity. So what we've done is those staff members that have been in this entity, the ALF memory care area, for the last week, we're going to keep them in that particular area and not allow them to kind of go out to the independent living side. We want to keep them there, staff that unit appropriately, provide all the interaction and the activities that we can that will have that quote unquote normal feeling for the residents that are there.
And at the conclusion of this video, we'll be doing a similar video to all of our team members, emphasizing there's no crossover at this point from this side of the campus into the assisted living / memory care. We've also expanded our environmental cleaning in that area. That was significant. And I'm not sure how many communications we did over the weekend to residents, family members, trustees, up and down the chart. And we'll continue to do that.
Yeah, it was a great team, to be called in over the weekend and to devise a plan. We had an outline of the plan truly to begin with, but to hone in on the specifics and have such an incredible, talented team that is willing to make this situation the best that it is and improve upon process. It says a lot of the caliber of the people that were there.
I think that's important. While I express my appreciation for their involvement, but when we don't really recognize, it seems like a weekend, nor should we during this period of time. But I want our residents, I want their families to know that as soon as I put that invite out there to Zoom, and sometimes I don't give a lot of notice, 30 minutes, maybe 60 minutes, and then we go into the conference very focused. People drop what they're doing, and pick up their computers, if you will, and we go into conference, and we always come out with a positive outcome. We had one meeting that was a two-phase meeting. You know, we teed up, I'll call it the situational analysis. And once we had a good feel for that, then we broke into teams, they reconvened, and then we as a group convened later and had the plan put together and a timetable on execution. So it's very impressive. It's behind the scenes, but I want our residents and their families to feel very good about what's happening. Very busy last 10 days or so, Karen, on following the Governor DeSantis executive order on mandatory testing. How many tests did you do within I'm saying 10 days, it was even, I think, less than that. I know.
Over 400, and as you can see, we've started the next round. Over 400, probably 450 tests were done. And as fast as it ended, the next phase has started. So we're in that already. It is definitely keeping us on our toes. Again, I have the fortune of working with Erica Underwood, who is just a phenomenal asset to Plymouth Harbor. She's an incredible nurse, and she is a machine. She's doing a great job.
It really is. You know, I mentioned this. We had a COVID leadership meeting earlier this morning on campus, and I asked you to comment on this, and I'll ask again. We get questions on when we get tested. I'll use myself as an example, which is very typical. You know, I was tested last Tuesday, and I didn't get the results back until either sometime late Friday or Saturday. So it takes 4 or 5 days just to get the results. On the other hand, for example, our own resident who was over at Sarasota Memorial, they ran the test, and within 15 or 20 minutes, they had the results. How is that possible?
You know, in the acute care world, which is the hospitals, they actually have the ability to do what's called rapid testing. As with anything in the medical hierarchy, it is the acute care world that has things first, and then it does trickle down to long-term care. The rapid testing will indeed trickle down to us. I know Natalia has actually ordered us a machine that we hope will come in soon that will give us the ability to test quickly and have those results within about 40-45 minutes. But currently, we're utilizing 2 different test labs. We're using Curative through ACA, which is the Emergency Operations Center. They're processing that through that particular company. And as you can imagine, this is hundreds of thousands of labs that are being sent to this company that are being processed. So I would say around 6-day turnaround time is what we're seeing with that particular company. We're also using LabCorp. LabCorp is a private company that we use here in Plymouth Harbor. It too services some of the acute care and some long-term care. They too have been inundated with numerous tests because some long-term care facilities have chosen to go with a private company rather than utilizing Curative. But they've been inundated, so sometimes the test results come back a little bit slower. Not too much that we can do about that other than really monitor our staff and our residents, do the screening, continue to push wearing the masks and the social distancing and the washing of the hands.
Well, you know, receiving that new piece of equipment, I'm going to emphasize that again, is going to be very, very important. And I want to recognize Karen, Leading Age Florida, and Natalia, our Vice President and Chief Financial Officer, who really have done their due diligence to find the right piece of equipment. And because it is a capital investment for us, we feel it's well worth the money. And once that arrives, I think we're all going to feel so much better, literally having those results, as you say, within an hour, maybe 45 minutes. So looking forward to that. So
me too.
It also was a little bit like when they were backlogged on the ventilators in the hospital sector. They were available until the need it got so great that they went into a backlog, and that's exactly what's happened with this equipment. You
Sure.
could get them early on, but now the orders have come in so fast, it's going to take a while. So we'll
Sure.
keep everybody updated.
Basic law of economics, supply and demand.
Supply and demand, absolutely. Karen, we need to talk about our reminder on our no visitation policy here. I saw on the news today that I guess yesterday, Florida set yet one more record, over 15,000 positive cases of COVID-19. And if we were a country, I think one of the charts said we would rank fourth in the world with the numbers. So even emphasize more why we have to continue to be in somewhat of a lockdown mode. Do you want to talk a little bit about our no visitation policy and a couple of questions that have come up?
Sure. We have no visitation currently at this time, and that's because what we're seeing in the community as well now at Plymouth Harbor with some of our staff members is that high number. So what we have to do in order to keep everybody as safe as possible is really have no visitation inside the building or on the outside of the building as well. As much as we would love to have you sit under the trees, unfortunately at this time, it's just not possible. I've had a number of questions saying, well, I just have a table to be delivered or a chair to be delivered. But that delivery brings in a person who has been exposed to who knows what, and then that exposure then goes to Plymouth Harbor. And to keep that risk of exposure down, we have to keep that no visitation policy in place and do it very, very intensely. As I was talking to one of our agency persons that come in, she was just a little bit frustrated with me because she did not have a COVID test. And as you know, by way of ACA, we have to have COVID testing done on every personnel that comes in to Plymouth Harbor. And she was saying, I'm just trying to do my job and I want to go see my resident. And I said, well, I can appreciate what you're saying, but I'm trying to do my job and I'm the gatekeeper. A lot of times they're not quite so happy that they can't come in. But again, it's for the safety and the well-being of each of our residents that we have to really keep that no visitation policy in place at this time. We know this is not going to be a long time, lifetime thing. This too will pass. But for now, we need that no visitation policy in place.
And I know we had the family member call and was concerned about the private duty, working with her mother, and was asking what is our policy or how can we enforce the private duty wearing the mask?
Yes, this is where the residents have a role to play in keeping the safety present here at Plymouth Harbor. If you do have a private duty that comes into your apartment and they take off their mask, please ask them to put their mask on. They are exposing you to something that they have been exposed to themselves. And sometimes it makes it kind of awkward, for you to have to say something like that. And if it is awkward, call me. I am so glad to talk to anybody at any time about the need for them to indeed wear their mask and keep it on. So again, your comfort level, if it's not, give me a call. I'll be so glad to do that.
You are living in a very safe environment, and it's our number one goal to keep it just that way. And
absolutely,
we put out these cautions in our updates, and but there's a lot of positives going on because of what we're doing. And as I've said on almost all of these videos, that's because of the support we're getting from our residents and the family members and our team members. And our team members have a big role to play in this too, because when they're away from Plymouth Harbor, we've asked them, all of us, to really contain where we go. And certainly when we're out, make sure we follow all of the safety and safe distance rules, which are so important.
Absolutely, Harry.
Karen, that's all I've got here on my notes. And I think that's your cue
Okay, well, we want to remind everybody to keep that social distance at all times, that 6 foot perimeter around you. Please remember to wash your hands, scrub them up, use that soap and lather it up really well and let those germs go down the drain. We want to make sure you hit those high contact areas in your apartment, get those keys and those cell phones as well. But most importantly, if today, any day, every day, this is so, so very important. Remember to wear your mask. It'll protect you, it'll protect those that you love, and it'll help us at Plymouth Harbor keep that safe environment.
Very good. Well, Karen, that brings the conclusion of this video, and that means it's time to wear our masks. Thank you very, very much.